turn over to Nicole in a second. But before I do so, I just want to perhaps introduce the topic as well as Nicole and give her the credit that is due to her and to the topic. So you see on the screen, we're going to hear about the Sustainability Embedded Quality Improvement Framework and Toolkit, which really is a framework that aims to link environmental sustainability to healthcare quality domain in treating it as a whole in an aligned fashion as opposed to something that is separate. I'll introduce Nicole in a second, but really, I think this speaks to the ongoing understanding that we need to broaden our understanding of quality and of safety in healthcare. Many of you will remember that we used to have the triple aim framework. We added well-being of providers, of staff as a quadruple aim. We added health equity as a quintuple aim. All of these things are crucially important. And perhaps we need I don't know what the next one is, hexagonal aim to be able to ensure that we more explicitly include sustainability and environmental considerations. The reality is that unless we align it together, we are always going to do this as a separate thing on the side of our desk. And I mean, clearly the world is burning. We need to have it a bit more of an aligned and uh, uh, impetus to be able to do this. At UHN, where I work, I think we're getting there slowly but surely. But one concern that I see is that, and I'm biased given that I do a lot of quality and safety, I mean, all of the quality and safety work. If somebody tells me, "Oh, I'm working on a QI project. I need to go to this meeting, to this committee, to this group," I don't think anybody's going to bat an eye that this is really crucially important to what they are doing as part of their day-to-day job. If somebody says, "Well, I'm going to work on a sustainability environmental project," there's certain people for whom it's expected, but for a number of other people, I think it become a bit of a surprise. And so I'd love for us to move into a direction where those are embedded or not, but they're both seen as something that's so crucially important for the future of our patients in our organizations. And to that extent, I think Nicole Simms is the perfect person to help us get there. She is a training and education lead for the Collaborative Center for Climate, Health, and Sustainable Care and executive lead for Cascades. She has training as a PhD from the University of Minnesota in Geography, Environment, and Society, as well as an MA from University of Toronto. And through a variety of educational offerings developed with health partners, she really tries to deliver interdisciplinary learning and opportunities that will build our pan-Canadian capacity for sustainable health systems. Nicole, thank you so much for being here and really looking forward to your thoughts. Turn over to you now. Thank you.
Thank you so much. I'm very glad to be here with all of you today. I'm just going to share my screen and confirm that you can all see that and hear me. Yes, amazing. Okay, so yes, I would like to talk to you about sustainability embedded quality improvement, really positioning sustainability as a core dimension of healthcare quality. So I think many of you are familiar with Cascade's work. We focus on 10 priority action areas where there's clear evidence and experience to justify decisive movement forward. And this includes shifts in care pathways, which you can see sort of in the center demi-circle here, as well as critical enablers of system change. And you see quality improvement and patient safety right at the top there. We really see that as a crucial enabler in our work towards more climate resilient and sustainable health systems. So I want to really delve into why that is today. And I want to start by kind of addressing a bit of a misconception that high quality care necessitates the production of high emissions, right? And so some people think, oh, the health sector should be exempt from any, caps on emissions because it's providing this necessary service, and these emissions are just an unfortunate kind of byproduct of providing care. This is a graphic from The Lancet that plots greenhouse gas emissions from healthcare on a per capita basis against healthy life expectancy. And we see here that many countries with high health sector per capita greenhouse gas emissions, like the US and Oman, have relatively low healthy life expectancies. And just a caveat here to note that we know that health is not solely determined by health services. However, if it were the case that high emitting care is required for high quality care, we would expect to see a different thing on this graphic, right? Canada has relatively high per capita health sector emissions. It's doing better than the US and Oman in terms of healthy life expectancy, but we can see that there are many countries with lower emissions that have higher, healthier life expectancies, like Spain. So this tells us we do not need to have high emitting health sectors or high GHG emitting health sectors to have better health outcomes. And even beyond this, we posit that high quality care is, in fact, often more sustainable care, right? So it's not just to say that high quality doesn't have to be high carbon. It's actually that high quality really shouldn't be high carbon. So let's delve into this a little bit further and really think about what it means to have sustainability embedded quality improvement. So these dimensions or domains of quality healthcare will look familiar to most of you. Safe care should be safe, effective, patient-centered, efficient, timely, and equitable. These are the quality dimensions defined in 2001 by the Institute of Medicine. And we've seen these evolve in different ways over time. They've been modified to suit different local contexts. But one of the modifications that we've started to see is that environmental sustainability is increasingly being recognized alongside these quality domains. So in 2013, the Royal College of Physicians in the UK proposed sustainability as a formal domain of quality. So you can see it there as this seventh additional domain. And this is an idea that's being taken up by the Center for Sustainable Healthcare, which called for sustainability to be treated as its own category in quality improvement, also in the UK. So Cascades takes a slightly different approach to this. We actually embed sustainability across those six quality domains or dimensions. So rather than seeing it as a separate quality domain, we embed it within the existing domains and position it as a core component of high quality care. And so the core idea here is that if we focus on delivering high quality care to all, we are also moving towards care that is more sustainable for people, for systems, and for the planet. And this is really based on the idea of co-benefits. Because what we find is that quality initiatives often yield environmental co-benefits, even unintentionally. And sustainability focused projects really should be in the healthcare space, enhancing multiple dimensions of quality. So if we find ourselves working on a sustainability project and we can't actually connect it to other domains of quality, that could be a signal that it may not be an optimal project. And so we're actually seeing this idea being implemented in practice. And this is it's very soon to be published, updated health quality matrix from HQBC. I think this is going to be launched in the next week or so. You can see how they have embedded environmental sustainability across their dimensions of quality. And again, they've slightly adapted those IOM domains to suit their provincial context. But you see the idea here, environmental sustainability runs across all of these dimensions of quality. And I want to give you an example of what this could look like in practice, because I mentioned that quality work often has these unintentional sustainability benefits. So here's an example of a project that might be undertaken in pursuit of timeliness. A project that enables the use of digital care at home in the form of remote blood pressure monitoring for low risk patients with hypertension. So, from a quality perspective, this project might happen because people are seeking to improve patient access to health information, to prevent or identify worsening health outcomes at earlier stages, or to empower patients to manage their health. So, cutting across into that patient empowerment domain. So, no consideration of sustainability here, However, we can make those connections because if conditions are managed early on and appropriately, we can avoid high carbon intensive care. We can also potentially reduce travel and its associated emissions to physical healthcare locations. I will add the caveat that this technology does involve some emissions, but on balance, for this type of technology, they will generally be much less significant than any travel related emissions. So this is just an example of a QI project that, has nothing to do with sustainability on the face of it, but when you dig a little bit deeper, those connections are there. And when we think through these connections, we really want to think about these multiple sort of levels at which we can achieve sustainability through prevention, through stewardship, and also through depollution and decarbonization. And so here's another example from the Ontario Surgical Quality Improvement Network, with which many of you will be familiar, thinking about sustainability as this co-benefit of quality work. So OnSquin launches these campaigns every year. They decide they're going to focus on different quality initiatives. And in 2018, they had a campaign focused on reducing surgical site infections, and they had some good results in their adult and pediatric patients. They were able to avoid SSIs. And we call this activity data, or in QI work, this would be your outcome measures in your family of measures. But guess what? Each surgical site infection has an environmental footprint. So we were able to kind of go back in and take this data from the literature on the environmental footprint of surgical site infections and do a really rough estimate of some of the environmental benefits of this campaign, which again had no sustainability aims at its outset, but we can find these connections. And OnSquin has really run with this. Another way that they are demonstrating some sustainability connections is by looking at length of stay. So we know that adverse events like SSIs result in longer length of stay, and we have emissions factors per hospitalization day. So they were able to put their activity data around days in conversation with this environmental data on length of stay from the literature to arrive at this estimate of carbon savings that they then converted into this equivalency. And they extrapolated this across all of their OnSquin sites to really show the environmental benefit of this work. So when we think about sustainability in this way, we can really see that actually it aligns with so many of the goals that we're already pursuing within our organizations, within the health sector more broadly, particularly quality improvement. And sustainability is actually already part of our job. We're just not necessarily making those connections. And I don't say this so that we kind of pat ourselves on the back for job well done. We're already doing the sustainability and resilience work. We don't need to do anything more, but really to help us understand that we have the capacity to do this work. We can leverage existing priorities, processes, and resources to build on what we're already doing to make further strides towards sustainability and resilience. So I'll quickly talk through some different ways of thinking about QI as a framework for change. Why is it so effective? Because these links are inherent between quality and sustainability. Because QI provides this structured, evidence-based approach to change, it allows us to use data to identify, test, and scale solutions. We have capacity to make change in this way. We often have dedicated QI staff, tools, and processes already in place that we can leverage. And again, there's this alignment with organizational goals and performance priorities. So there's a few different ways we can think about this. We can think about QI and sustainability as kind of a mission, right? Where sustainability alongside QI, it becomes this guiding principle for improvement planning and decision making across the system as a whole, right? It's embedded in how we understand quality and our efforts to improve it. We can also think about QI as a methodology, again, thinking about PDSA cycles and how they allow us to really trial these different change ideas to try to address some of the root causes and problems that we identify. This is an example of a project to reduce unnecessary glove use in an ICU in BC. So they mobilized PDSA cycles to try a few different things, and they achieved reductions in glove use, environmental benefits, and improved staff experience. And what's important here is that the project used the same QI tools that we already rely on, right? They just added that environmental lens. We can also think about QI as a resource and spread infrastructure. So I already mentioned OnSquin. They mobilized not just the national, but the international NISQIP, this whole North American-wide surgical improvement program to identify indicators, to select change ideas, to report on the success of their initiatives. Health Quality BC launched a low carbon, high quality care collaborative where they had teams from across the province working on reducing inhaler use, meter dose inhaler use, and on different opportunities in the perioperative space. I'm going to talk to you about our SEQI toolkit in just a moment. We've also done work with Ontario Health to identify change areas and indicators that cut across acute care, community care, and long-term care settings so that really across an organization, we can be using the same indicators. Teams can have a common direction and this shared language for environmental improvement. And then finally, thinking about QI being mobilized for sustainability via its role as a governance structure, right? And this is an example from Sunnybrook, where environmental sustainability is included in their quality strategic plan, and they've embedded a specific sustainability priority through their nitrous oxide reduction project. So the work is being monitored, resourced, and reported through the same quality oversight processes used for other QI priorities. So now this becomes part of routine accountability rather than having these separate or siloed initiatives. So I want to end by just telling you quickly about two tools that we've developed at Cascades to help really clarify these connections between sustainability and quality. And these can be used at the project level, but I think they can also be used more broadly in thinking about quality improvement plans or priorities. So the first is the Sustainability Embedded Quality Improvement Toolkit, or SEQI Toolkit. This is essentially a Google form that people can fill out when they're working on a QI project to help them identify any links to climate resilience and environmental sustainability and determine how to measure and report on those links. So once you fill out this form, it takes about a half hour. It will generate a report. And actually, the report comes in three parts, so you don't have to do the full half hour in one sitting. But the report will indicate applicable sustainability principles and related metrics and resources that you can mobilize to actually estimate the environmental benefits of your project. And it can be used for non-sustainability and sustainability forward QI projects. So you can use it to integrate sustainability into an existing QI project, to retrospectively apply to a completed QI project, or you could use it as a training or capacity building tool to support others in applying it to their projects. We collaborated with lots of different groups on this: Vancouver Coastal Health, Interior Health, Providence Healthcare, and Health Quality BC. The tool is available on our website in its beta version. There's a form to provide feedback, but we are running a formal pilot of the tool from now through till March 2026. And I think we're actually getting Quebec on board. So we have 7 provinces involved, and we're really just trying to make it as easy as possible for people who are doing any kind of QI work to start to flag those sustainability benefits and actually potentially report on them in their family of measures. And then the last tool I'll quickly mention is our CASCADES Project Charter. This is a structured problem-solving approach to sustainability. It's essentially this iterative worksheet. It's really a process, a collaboration process, and it can be used as a communication tool to report problems, change ideas, and measured results. And it's essentially structured just like any QI project charter, where you're trying to figure out what the problem is, what we need to learn about the problem, and what improvement looks like, but it brings a green lens to it. So you can use this in tandem with the SEQI toolkit to really flesh out an entire project, whether that means that you're just bringing sustainability into a broader QI project, or you're working on a sustainability focused project, but you actually want to approach it as a QI project and flag the quality benefits of the work. So I'll just leave you with some questions for consideration. We can talk about them now, or you can take these away and ponder them. Um, but just think about, how does sustainability embedded quality improvement align, if at all, with your organization's strategic priorities? Is this a helpful way for you to think about sustainability work, to really embed it in the quality portfolio? Are there any past, present, or prospective quality efforts at your organization that you can now kind of begin to see how they might be linked to sustainability? And on the flip side of that, are there any sustainability projects that you are working on in past, current, or future, where you can actually now think, okay, maybe there are some quality benefits here that we should really be flagging and making those connections clear? And then what are the kinds of information, tools, or resources that you might need to better embed sustainability into your quality agenda?